Shockwave therapy is one of the hottest treatments in veterinary medicine right now, and some clinicians market it like it's a miracle for arthritis. But does the science actually support that? A brand new 2026 clinical trial gives us the best answer yet. First, let's clear up a common misconception. Shockwave therapy does not use electricity and it does not shock your dog. It uses high energy acoustic waves, essentially very powerful sound waves that travel through the injured tissues. And these mechanical waves create microscopic stresses that trigger a healing response in those tissues. Researchers think that shockwave therapy works in several ways. Number one, it stimulates new blood vessel formation. It increases growth factors involved in tissue repair, and it may decrease inflammatory chemicals. And perhaps most importantly for arthritis, it appears to change how pain nerves transmit signals throughout the body. So the goal isn't rebuilding cartilage overnight. The goal is reducing pain and improving function. Now here's where things get interesting. A randomized double-blinded clinical trial published in 2026 enrolled dogs with severe elbow or knee arthritis that hadn't responded well to conventional therapy. These weren't mildly sore dogs. These were very difficult osteoarthritis cases. And the researchers compared dogs receiving one shockwave treatment with dogs receiving two treatments about a month apart. Then they measured owner questionnaires, veterinary orthopedic exams, and even objective force plate gait analysis. And the gold standard for measuring how much weight a dog actually puts on each leg is the force plate. The results weren't a miracle, but they were encouraging. Many dogs became more comfortable, and many owners noticed improved mobility. Some objective measurements actually improved. The dogs that received two treatments generally showed somewhat more consistent improvement than the dogs that only received one treatment. But here's the really important part. Not every dog improved. Some improved a lot, some only improved a little, and some barely changed at all. That's actually what we'd expect from a study like this. Arthritis is not just worn out cartilage. Pain comes from the joint lining, the bone, the ligaments, the surrounding muscles, and even changes in how the spinal cord and brain process pain. So shockwave therapy mainly affects the tissues where it's applied. So if a dog's pain involves multiple mechanisms, as it often does, it makes sense that one treatment alone will not solve everything. So is shockwave therapy worth it? I'd say yes for the right patient, but it's not a replacement for weight management, rehabilitation, muscle strengthening, anti-inflammatory medications, or newer therapies like the anti-NGF monoclonal antibodies when appropriate. So think of shockwave therapy like another player on the team, not the entire team. The biggest lesson from the 2026 study is that shockwave therapy isn't snake oil, but it's not magic either. It's another evidence-based tool that can help some dogs feel and move better, especially when it's combined with a comprehensive osteoarthritis treatment plan. That's exactly how good medicine usually works, not with miracle cures, but with multimodality therapy targeting a disease process working together. So would you consider shockwave therapy for your dog, or have you already tried it? Let me know your experience in the comments and follow me for more evidence-based veterinary medicine.